Hello everybody, I am Dr. Murchana Khount, Assistant Professor, Department of Pediatrics, AIIMS Guwahati, and today I am going to talk about a disease which is showing an increasing trend in children these days, and that is dengue fever. Dengue fever is a viral disease which is caused by 4 similar viruses of the family Flaviviridae and is spread by mosquitoes of the genus Aedes. It is common in tropical and subtropical areas worldwide. How this disease is transmitted? When an Aedes mosquito bites a person who has been infected with dengue virus, the mosquito becomes a carrier of the virus, and when this mosquito later bites someone else, that person can become infected with dengue virus and later can become sick with dengue fever. The virus can't spread directly from one person to another in absence of mosquito. Coming to the signs and symptoms of dengue fever. The symptoms of dengue are generally mild in younger children and those who have the disease for the first time. But in older kids and adults and those who had been previously infected with dengue, they can have moderate to severe symptoms. The symptoms and signs are: the patient can have high fever, the fever can go as high as 105 Fahrenheit. The patient can have severe headache, pain behind the eyes, severe body ache, pain in the joints and bone. The patient can have rashes in the body, mild bleeding from the nose and gums, and easy bruising, that is from minor trauma they can have easy bruising. This disease, dengue fever, is also called break bone fever because of the severe bone and muscle pain that it causes sometimes. The disease as such do not break any bone, but because of the severe pain of the bones and muscles, it is called break bone fever. The symptoms usually starts 4 days to 2 weeks after the bite of the mosquito, and the symptoms typically last for 2 to 7 days. Sometimes the disease also causes some complications. The complications like severe bleeding in the GI tract, and this can cause nausea, vomiting, severe abdominal pain, bleeding as well in the body, severe respiratory distress and breathing difficulty, dehydration, drop in blood pressure, and sometimes shock. If any of these complications are seen, then the patient should be immediately taken to the hospital for urgent medical attention. Now coming to the diagnosis of the disease, how we will know that a patient has been infected with dengue? For the diagnosis, the doctor can diagnose the disease by simply looking at the signs and symptoms of the disease, and some blood tests are also required. In the early stage of the disease, within the first 7 days, some nucleic acid amplification tests are done to see the presence of the virus by RRT-PCR and NS1 antigen test. Later in the disease course, some serological tests can also be done like immunoglobulin M antibody testing, and sometimes both the testing, nucleic acid amplification test and serological test, both needed to be done. Coming to the management of the disease, how the disease is treated. The treatment of dengue is mainly symptomatic, as this disease is a viral disease. The physician generally advises adequate rest and plenty of fluids to prevent dehydration in mild cases, and for fever, body ache, and for headache, some drugs, acetaminophen like paracetamol etc. are advised, but other pain reliever medicines like aspirin, ibuprofen etc. should be avoided because they can cause severe bleeding in dengue fever. Most of the cases of dengue fever goes away in a week or 2, but if someone has severe symptoms of the disease and if the symptoms get worse within first 1 or 2 days the fever subsides, then such cases require urgent medical consultation to rule out the complications. Severe cases are examined by the doctor to rule out complications, and depending upon the severity of the disease, the doctor can give some IV medications, IV fluid, and in advanced cases blood transfusion may also needed to be given. Now coming to the most important part, how this disease can be prevented, as prevention is always better than cure. A dengue vaccine is available for children between 9 to 16 years who have already had dengue fever and who live in US territories where it is common, but such vaccine is not available in India yet. So preventing mosquito bite is most important protection here. So we should use screens on the doors and windows to prevent mosquito coming inside the house. Children should wear long sleeve shirts, long pants, shoes and socks when they go outside the house. Mosquito net should be used over the bed at night. Some mosquito repellent creams and roll-ons are available to be applied on the clothes to prevent mosquito bite. Limit the amount of time spent by the kids outside the home is most important, especially during the evening time, to prevent mosquito bite. And most importantly, we should not give places for mosquito to breed. Mosquito usually lay eggs in standing waters. So in the house or around the house, wherever there is standing water like containers or discarded tires, they should be discarded immediately. So that's all about dengue fever. Thank you.